recording. Thank you, server. Welcome everyone to the second day of the University of Maryland Baltimore Global Health Summit, Decolonizing Global Health Education. My name is Carlos Alberto Fairun Guzman. I am part of the summit team, and today we have a wonderful agenda for you, and we hope you are able to stay throughout the day. Before I start and give the word to Dr. Roger Ward, I would like to provide a quick 1-minute recap of what happened yesterday, because we had a really powerful and engaging day in our summit. We first heard a powerful keynote address by Dr. Ijeoma Nodim Opara, who, as my colleague Amy Ramirez mentioned in our debrief session tomorrow, actually delivered a keynote that, beyond its content and the value of its content regarding in relation to decolonization, the means by which it was delivered was an act of decolonization itself. We heard snippets of even poetry and singing that we don't usually see in these academic environments. So I encourage everyone to see that keynote address, which we have posted on YouTube for easy access. We also heard from an amazing group of trainees and students that shared with us their perspectives on how they're within their future professions, dentistry, physical therapy, medicine, pharmacy, and nursing. There's still a lot to do if we're going to speak about decolonizing professions and being truly inclusive and equitable in the way within we educate our future professionals. Then we had an amazing Reactor panel who, with their expertise and their experience, really came to shed some light on how the decolonization conversation needs to borrow from different fields, different lenses, different experiences, and also just highlighting the importance of student movements, but also the role that faculty and leadership within institutions have to play in order to move the needle forward. Finally, we heard from Courtney Jones-Carney and Dr. Thurka Sangaramurthy, and we heard, if you're an educator, this is a very important conversation because we heard the concrete ways in which we can start applying decolonizing principles in our classroom today. We hope you enjoy our second day of the summit. And for now, I'll leave you with the University of Maryland Provost, Dr. Roger Ward. Dr. Ward, please.
Good morning or good afternoon, and welcome to day 2 of the 2021 UMB Global Health Summit, focusing on decolonizing global health education. Even as I bring greetings from my adopted home here in Baltimore, Maryland, in these United States, my mind never strays far from my own country of birth, Trinidad and Tobago in the West Indies, where the COVID-19 pandemic continues to claim lives in unprecedented numbers daily. My elderly parents and much of my extended family still live there, which is why this topic of global health, equity, and justice is so very important to me personally. As you heard yesterday, our inaugural UMB Global Health Summit was held in May 2019 with a focus on research and service, particularly on the African continent by the Center for Health, International Education and Biosecurity, CHEB, and the Center for Vaccine Development, CVD. 60 individuals came to Baltimore from our international sites for that event. This year's summit is spearheaded by the very capable Dr. Carlos Ferron Guzman, one of our new associate professors in the graduate school here at UMB. Dr. Guzman is supporting the launch of the new Masters of Science in Global Health and a certificate in Global Health Innovation this fall. As we contemplate the launch of these cutting-edge educational programs, it is appropriate to focus this year's summit on education. I fully expect that, as was the case with our 2019 summit, this 2021 summit would leave us with an ambitious, forward-looking, and action-oriented agenda to pursue over the next couple of years. By way of example, let me share with you some of the fruits of the 2019 summit. At the end of that summit, we held a strategic planning session. The results of that session were incorporated in a campus-wide internationalization report that was completed in November 2020. The executive summary of the 143-page report is available online. The internationalization process was facilitated by the American Council of Education and brought all our schools together to catalog and celebrate our global accomplishments and activities. Perhaps even more important, the internationalization process was forward-looking and documented our aspirations to work together in an aligned and coordinated way to meet our mission, to improve the human condition globally. To implement the recommendations outlined in the internationalization report, the theme of global engagement and education will be adopted in the university's 2021 to 2026 strategic plan. Although still in draft form, the strategic outcomes under that theme will ensure that all students have the opportunity to engage in global learning during their time here at UMB, that there is a focused leveraging of institutional resources to support sustainable, innovative, ethical, and responsive global engagement, that there is an expansion of university programs that support and celebrate the richness and expertise of international students, scholars, and faculty, that there is a comprehensive and integrated communication strategy to promote UMB internally and externally as a national and international global health and education powerhouse, and that there is a coordinating hub to add value and facilitate global operations. Work towards the coordinating hub is already underway. In anticipation of continuing growth in both the volume and variety of UMB's international activities, we are launching the UMB International Operations Initiative. Our aim is to build over the coming year a robust infrastructure to facilitate and effectively support all of UMB's international operations. The initiative will include a focus on reflecting and rethinking the practicalities of how we engage globally and apply a decolonization lens to our operational practices worldwide. I want to share some important news on another front. The goal of this summit is to elevate the voices of the so-called Global South in our practice and teaching of global health. Perhaps the most important thing we learned during the internationalization process, and something that has been amplified by the COVID-19 pandemic and discussions of structural racism, is that we have as much to learn from others as we have to share. If our global impact is to grow, it needs to be informed by the expertise and the experience of our partners around the world. The Center for Health, International Education, and Biosecurity, CHEB, is one of the university's most valuable and impactful programs through which global research and service takes place. The center's work in 8 countries on the African continent is comprised of a network of international experts who work with local stakeholders to combat infectious and non-communicable diseases. Tragically, in March of this year, one of CHEB's Nigerian experts, Henrietta Sele Thierry, met an untimely death, leaving behind her husband and 2 young children. At the time of her death, Henrietta was the ethics and regulatory lead for CHEB in Nigeria. She joined the Nigeria team in 2007 as an assistant research study coordinator and rose quickly because of her skills and competence to positions of greater responsibility. Henrietta was instrumental to the success of numerous global health projects. For example, in the Nigeria HIV Impact and Indicator Survey, the largest HIV-focused survey ever conducted anywhere in the world, Henrietta oversaw regulatory affairs. In the ECHO project in Nigeria, she led its successful implementation, which subsequently expanded to become the West Africa Regional ECHO project. Henrietta's life was a gift to all of us and to all of those whose lives were touched and saved because of her work. To honor Henrietta's life and work, the graduate school at UMB has renamed our primary scholarship program in honor of her. As the Dean of the Graduate School, I am pleased to announce that the Henrietta Selle Thierry Scholarship Program will provide 10 full tuition scholarships to university staff living and working outside of the United States. 10 students a year will be able to access the graduate school online Masters of Science in Global Health and Masters of Science in the Health Sciences. According to Dr. Mansharat, CHEB's Global Director, Henrietta was a kind, diligent, resourceful, results-oriented, and dedicated member of the Nigeria team. As the Dean of the Graduate School, it seems fitting to honor Henrietta's spirit by giving others the opportunity to grow and contribute to science as she did in her life. I understand that some members of Henrietta's family are in the audience today. I want to take time now to recognize each of them. First, Henrietta's parents, Mr. Ashaku Thierry, Henrietta's father, Miss Kanyang Thierry, Henrietta's mother, Henrietta's three sisters, Miss Yop Panshang Tengmang, Dr. Garos Jakim, and Dr. Mafeng Thierry. And of course, Henrietta's two daughters, Tihila Gabriel and Nima Gabriel. Thank you for joining us today. Please accept my sincere condolences as you continue to grieve and mourn the loss of Henrietta, who was taken from you and us far too soon. I hope that this scholarship program is a light that will provide some measure of solace to your family and serve as a lasting legacy of Henrietta's life. Through our philanthropy program, we will add to the scholarship funds over time to create even more opportunities for international students to obtain degrees from UMB. Doing so provides the opportunity for people to obtain graduate degrees to enhance their professional growth, but also, perhaps even more importantly and very relevant to this summit, we believe the Henrietta Selle Thierry Scholarship will bring different voices into the classrooms to enhance our teaching, learning, and impact. To begin today's first session, I will now turn the microphone over to Dr. Bonnie Bissonnette, who will introduce the two keynote discussants. Thank you all for your engagement and participation.
Thank you, Dr. Ward. I'm Bonnie Bissonnette, the Director of Education Abroad and International Safety at UMB, and it gives me great pleasure to welcome two colleagues from the African continent, both of whom have served in their respective countries as ministers of health. And I won't provide a detailed introduction from they both supersede that, but their bios are available on the main conference or summit homepage, not the page with the lobby for our beautiful virtual conference center, but the page where we logged in with all the beautiful blue and the photos. Up at the top bar, there is a link to speakers, and I can urge you to look there to find out the full details of the rich and long careers of Drs. Agnes Binagwaho, welcome, Dr. Binagwaho, who served as the Minister of Health in Rwanda. Pleasure to have you with us, thank you. And Dr. Samba Sow, who served as the Minister of Health in Mali and is also on the faculty at the University of Maryland. Dr. Sow, welcome. I'd like to, before we get started, also make a quick note that Dr. Binagwaho also is serving with the Consortium of Universities for Global Health and spearheading their decolonization efforts. So we are delighted to have two such talented and experienced professionals here to share with us from two different countries in Africa their thoughts on the topic at hand, decolonization. We originally shared questions with both of our presenters today, and in speaking with Dr. Sow earlier, he's prepared some remarks that will address the bulk of the questions. And Dr. Binagwaho, I'd like to start with you with the opening question, and we'll begin a bit of a dialogue. I think I'll be nodding and smiling a lot, but the questions, I will share them with you now as an audience, so you'll know what the questions are that they'll be discussing. But I look to sort of sit back and enjoy the dialogue. The questions, and the first question I would address to you, Dr. Binagwaho, to start with would be, as two former ministers of health in countries that experienced colonialism and independence movements, what does it mean to and for you when we speak of decolonizing global health? And we'll get to the rest of the questions which flow from there. Thank you.
Okay, thank you so much, first of all, to having me. Thank you, Carlos. Thank you, Bonnie. Thank you, all the students and all the people who have helped you to set this great gathering together. So decolonizing global health means a lot of things, because I have to tell you, the colonialism and the Western, what we call Western supremacy, white supremacy, high country income supremacy, is embedded in everything that we are all swallow from the first drop of milk that we receive. So it means bridge the gap between theory and practice by creating a real framework to shift the center of gravity for what we call the global south, but the low-income countries that most of the time map really the former colony, to shift the center of their gravity of global health inside their country. It means also that we need to change people's attitude regarding the value of what the global south can bring to the table, about also providing resources. There was a great article recently in the Nature saying, how did you give to an American the NGO the money to do research about malaria in Africa? We have enough researchers. Give them the opportunity not to be treated like second zone researchers. So, and I also want that the delay we have. I totally understand about the reparation about slavery in the US, but we have to understand also that the lack of progress we have can be explained by the fact that since 1960, the rich countries have taken out of Africa $172 trillion through extracting our goods, etc., in our soil, without that bringing back resources to us and not allowing us to develop our people for education, for health, for infrastructure, for construction. And it has continued to build the rich countries and to make us poorer and poorer. And also, when you fund institution, you need to fund the South for studies to be done by the South. We can partner, it's okay, but not lead like people who have a brainless. And so partnership is great, solidarity is great. And I can give you also an example, not only in money to build, in money for research, in the way we publish what we have researched. There is article for COVID done by US people, US based, talking about what happened in Africa. they were accepted in a high, very known scientific paper. The paper done by African, talking about Africa, living in Africa, well written, was refused. And also you can see that the world, the entire world, was watching more the non-African based article than the African-based people article. So the readers are biased, the journal are biased, the finance, the financial source, those who are decided are biased. We are all biased. So it means a lot.
Wow. Yes, thank you. And I appreciate your candor and speaking very straightforward as to the degree of the effect that colonization has had and continues to have. Dr. Sow, are you with us?
Yes. Yes, I am with you.
Please, if you could respond to the question, and I know you'd like to continue. Do you mind? I'll just share some of the other questions you'll be addressing as we go through.
Yes, please.
The other questions we asked both Drs. Binagwaho and Dr. Sow to address would be, what would you like to share with the 90+ students and scholars that are participating in this summit in terms of how they can have an impact in health equity in their future careers? And of course, I'll remind everyone that we're talking about students from multiple professions that are joining us here today. Social work, dentistry, pharmacy, medicine, nursing, law, and students that are getting doctoral degrees in any number of those degree areas. We also asked about how the decolonial lens and movement can best improve global health. And in addition, in a world in which we dismantle unequal power structures in the field of global health, what is the aspirational goal of the field? We also asked about whether COVID-19 pandemic has facilitated a conversation about decolonization. And I don't know, the two of you may not have seen, but we had the statistics shared with us at the beginning of the summit yesterday, in which we learned that 98.8% of the vaccines for COVID-19 have gone to mid and high income countries, 0.2 to the lower income countries. And I think that speaks directly to this. Dr. Sow, please, thank you.
Thank you very much, Bonnie, and thank you very much, Madam Minister Agnes. Great point, bonjour, and so pleased to see you again. Still with the same very strong, robust African energy. I need that. Thank you very much for your points. Very well taken. I mean, learning from what you said and hearing from what you just shared with us, I completely agree with you. And I just would like to build on top of that and say, try to gather these questions, because to me, they are all linked. Great questions, Bonnie, really absolutely great questions. Before I start that, I just would like to thank the organizer of this summit. UMB Global Health is really up and running. I've said this to President Perman and to the Dean Alvarez. I told them that this is the way to go forward, and it looks like it's really working very well. We would like to see at the end of this meeting what will be the main point to share. So living with responding to COVID, I know COVID is one of your last questions, but I really think that COVID is, the way COVID is today, we cannot do anything but talking about that. So responding to COVID-19 over the last year or so has shown us clearly, I think, that the only way to address the complex issue facing us today is to collaborate. So that's the number one keyword that I want to put there. We need strong partnership, very strong partnership, strong international cooperation, and crucially, we need equity to be at the forefront of this issue. That means that we need inclusion, as it was said by Minister Agnes. There cannot be equitable partnership without proper and considered inclusion. That's very important. And without proper country representation, without the proper partners being invited to the table, I think it is very hard to talk about country ownership and decolonization in any meaningful sense. That is to say that when faced with the many challenges and the great many difficulties of the moment, COVID-19, of course, and ongoing structural primary healthcare issues that face countries like the sub-Saharan African countries, especially like my own country, Mali. We have COVID pandemic, and we also have political upheaval pandemics. We have political crisis, security crisis, coups and counter-coups like every hour. We can actually go a long way to answering the broad general questions of colonial legacy with concrete steps here and now. This is all part of a big package. And inclusion is key in that, has its proper representation. When we try to think of solutions to problems such as we face today, one important step to our decolonizing attitude and actions is to make sure that decisions are taken and implemented in the most suitable places. This means giving credence, space, and trust to institutions and partners who know the countries and territories in which they work. This has been clearly said by Minister Agnes. So local and national government won't always know what is right, of course, but never never will funders also know about that. If, however, we make sure that invite the right people to the discussions and listen to their opinion, I think we have a better chance of arriving at a solution which are not imposed from outside. And that was clearly described also earlier by Minister Agnes, for the benefit of outside partners only, but rather are conceived and implemented close to the communities we seek to serve. I've learned over my career that it is communication that is key. Communication is key. Having platforms like this, congratulations to you guys for arranging such a great summit that will allow us to share, to communicate, to discuss. Listen to your communities, listen to your partners, and listening to what countries need and want is key. I have spent most of my careers translating evidence for policymakers. There are a lot of publications around that, or translating science for communities. We call this data to action. This has been on and on. We published a lot around this. This only works when all parties come to the table with equal say and equal influences. That is the only way we will get most evidence-based and efficient intervention into our communities where they can have the most impact. My opinion on colonial questions are closely linked to my opinions as a scientist, and many of the frustrations I have felt over the years come from that. For example, it can be frustrating to see actions implemented and driven by external forces from when you know as a scientist that those activities, evidence-based for communities, they are being implemented. So we try to act on that basis of available evidence. That is the concern of our work as scientists. And we try to remove bias from our trials and experiments as far as we possibly can. I think then that we can adopt a similar attitude to questions of coloniality and decolonizations. So quite simply, we should try to apply our bias reducing principles wherever and wherever we can, whenever we can, wherever and whenever we can. I mean, this means insisting on a variety of voices. It means listening to people who have experience of scientific fields and of literal fields, that is their own countries and communities. So I just want to say about one of your key questions on how knowledge, this is my last point to mention. This is one of your really key questions, how knowledge that is mostly made in the global north fails to address the real needs in the global south. Would you give us an example, that's still your question, of how this state of affairs challenges effort to meet health needs in your respective countries? So I will just say very quickly that this speaks to the fact that the agenda is often set and driven by the global north rather than countries themselves, and indeed the communities where the needs and questions arise. So good equitable partnership, again, good equitable partnerships are the foundation. We need to ensure we can answer the complex health issues, develop the product, and address the emerging health problems we are seeing around us. I am very lucky that I have many of those great partnerships and proud of what we have accomplished together. One of these great examples is my great partnership with the University of Maryland, CVD Global Health, the whole university. My American partnership, currently great opportunity for myself. I would like to congratulate again, even by inviting me to such a great summit, to me means a lot. It's part of a decolonization of this whole thing. So you are ahead of time. You are very proactive. This is leadership. Your university leaders are ahead of time, very proactive, good action. But I also have sadly seen to many instances where money, as this was described so nicely by Minister Agnes, money and time is invested in the wrong way or to answer the wrong question that we don't need necessarily. So it will only work if there is a strong, equitable partnerships and good communication. Thank you.
Thank you, Dr. Sow. Dr. Binagwaho, would you like to react?
Was on mute. My reaction is yes, yes, yes. And we have a lot of example around that. If we go for your question about creating a global model, the high-income country push of the brain drain. You had a question like that? Oh, I did change your question.
Oh, you could answer whatever question you feel is important to get the...
Yes, I got it, Bunny. I just want to say that the way the relations are done and the way the investment is done systematically in high-income countries and in low-income countries, the value of my work, even if I'm a better expert and I want to challenge all the experts in the high-income country, I'm sure there is no reason to pay my time lower than their time. And this is also a colonialist attitude, because if we do a work for 15 minutes or for 10 minutes and its value $100, is for me, they pay me only 25 or 50. That means 5 minutes I'm working for free. What is called a working for free if it's not slavery? Just tell me that. So they slave me, they slave my brain, they use it, and they underpay me just because I'm coming from the global south. So this is also a colonial that is systematically used, even in the best partnership with US universities. They all agree that our researchers are paid less for their time and their discovery in that great partnership. So even the best, what I'm saying, colonial mindset is so deep embedded since the first drop of milk, breast milk or buttermilk, that we need to change everything. Another thing that we can, and for me, at my University of Global Health Equity, we say no. We say no. Slavery, we are all fighting it. Open your eyes. And the big problem, dear Bonnie, is that many of our best friends in high-income countries are collaborating to this slavery without being conscious of that. The traditional knowledge that is undermined, but so much used, because look all the tradition, the current working medicine for malaria. You have big pharma in the north that are taking advantage of the great knowledge, traditional knowledge of people around the world, from quinine to artemisinin, etc. What is the payback to this traditional knowledge of people who can even not grow, not research on their product? This is called stealing. When this is not proper. The other thing for your question on how students can participate in this, how can they in the future be better global health fighters, is by reflecting first around all those issues. Take nothing for granted. We need to think that we need to revisit all the framework, the document, the way we practice, because it's wrong. And for them to revisit the world with a biosocial lens, to look at the world with respect and equity. And it's not because, like many people in my country, don't speaking good English. Many speak. I'm not even somebody who speak good English, but you hear me, and language is done to be understood. And I don't care when I make a mistake. And people are looking at you and you seem dumb because you don't express yourself in their jargon. So this is also a colonialist attitude. Be listeners, attentive, try to find what the communication is about, and be humble. So as students, be always curious learners, and I encourage you to contribute to global debate like this great debate you are creating. It's not an easy debate, because the ball is everywhere, in the Western world, but it's also in our world. We need to stand and stop to be colonized in our mindset and stop accepting it. And this is a long journey where the next generation will be continuing the fight that we have, that have been started before us. And also to go with the idea that Don't be compassionate for the vulnerable in the global south if you are not compassionate for the vulnerable in your country. This is fake compassion. If you can let people die, if you can let the Black community be more affected by COVID, more dying by COVID, having less access to vaccine against COVID, without moving for that, don't come in my country and say that you want to save us. Global health is everywhere. It's not in Africa and Asia. Global health is every place we have our 2 feet. And this is very important for the student to understand that they have to start to change the world where they are. This is the best example you can give for the future. And also understand that vulnerable are not only the poor. In a society where homosexuality is a crime, homosexuals are vulnerable people, etc. So the vulnerability is context specific, even though the regulation of partnership should be context specific if we want to really make a difference. And I can go on, Bonnie.
Oui, et peut-être on peut parler en français parce que ça
Je peux parler en français aussi.
C'est un peu moins colonization. Well, it's not really less colonization, and I don't speak very good French.
It is the same. All those are too colonial. I can speak in my language, but we don't have translation. So English or French is too colonial language. We can analyze on peut analyser la façon dont ils ont colonisé, mais n'oublions pas que aujourd'hui, à l'heure où je vous parle, l'or des pays d'Afrique de l'Ouest se trouve à Paris et ils payent pour déposer leur or, pendant que Paris l'use pour faire des prêts et gagner de l'argent là-dessus. Et ceux qui veulent changer ça sont éliminés. So I don't know if you get what I mean. Colonial is still ongoing and very active.
Yes.
And in Francophone countries, African Francophone countries, what is a nonsense to say like to say that like France has an ownership in a portion of Africa. However, all the gold of those countries are seated in Paris, and they all pay for the gold to stay there when France rent it and get money out of it. And all those who say we want our gold home are in big, big trouble. So colonial is everywhere. En français, en anglais, and even in Spanish and Portuguese.
Thank you so much. I am blown away by your willingness to speak very, very passionately. And I thank you, because I think that the students and scholars who are hearing your words, who are younger than I, will go out into the world with more information than I know I had at the beginning of my career. And I appreciate very much the passion of your words. I'm going to put you both on the point here now for us. As a university positioned in a high-income country, doing global work with you as partners, and Dr. Sow, I know you know what UMB does, how we do it. We're looking to examine it and take it forward in a positive direction. So what would you tell us? What are some concrete suggestions that you have, knowing what you know about UMB now? What are some things that we should be doing to put this decolonial lens on those things? Dr. Sow, let's start with you.
Thank you. Sorry, always learning, muting and unmuting. I am sorry. Yeah, I completely agree with you, Minister Agnes, Prof. Je suis tout à fait d'accord.
Call me Agnes, my dear brother. Call me Agnes.
Call me Samba, my dear sister. Yeah, merci beaucoup.
Yes.
Donc, I completely agree with what you said, and I think that. Bonnie, what I really think that could be a strong takeaway, not only for the student, but for all of us, including the university, as I said, a few years ago, maybe 2 or 3 before COVID, there was actually maybe your first Global Summit meeting, or if it's not the first, the second. I was invited as a guest speaker. I told this to President Perman. He was president then. I think now he's even
He's the chancellor of the entire University of Maryland.
Oh my
system.
God, I don't know how to call him now. So tell him and tell the current president and the dean that I am saying, as an African technician, as a field worker, as a person who suffered, born and grew up in colonialism, and now trying to help and contribute how to change things in a much more positive way, that your university is being very proactive on this. Even by letting us, my sister Agnes and myself, inviting us in a much more transparent, open way, and let us talk to your students. And I'm sure this group of students are not all 100% Americans. I'm sure there are people from Africa, from Asia, from all over the world. So this is what I call global health. This is what I call a sharing partnership. This is what I call transparency. This is what I call dialogue. And this is what I call communication. So she said it. She said we need to communicate, and non-stop communication. So the key and the number one thing is to talk about it, to let it out, to share. That's the only way then, point by point, step by step, we can figure out how to solve each of the issues and how to make it more global. Look, COVID vaccine. Some countries have enough for 3 times, twice more the country population, while in places like Africa, the top number 1 top high-risk people, healthcare worker, we even don't have enough to cover the healthcare workers. Look, vaccine and many other drugs are manufacturing. Africa, for example, is representing 16% of the global population, but we have less than 1% manufacturing operation in Africa. I can't get that. And so far in many of our countries, we only have 1 vaccine. We even don't know if this vaccine is working on variants, etc. So there are a lot of very, very sad issues happening. Global health at this level is the only way to come together, study it together, understand this together, and share together and convince, data to action, generate our ideas and data, put it together in a very objective, transparent, convincing way, and take that to the country leaders. Wherever they meet, in France, in the US, the president of Rwanda is one of the great leadership today for all of Africa. Congratulations to this man. And we are so proud. University of Maryland today, to me, this is a perfect example. I've been in another meeting with some other universities, perfect examples, global health, population health. That was University of Washington last week, for example. This is the best way. And my last sentence is, I said that I was so proud and lucky to be working with you, but also sad with working with other opportunities. So for me, we will only work if there is a strong, equitable partnership and good communication. So let's try to open this and continue to do this. Congratulations to you, Bonnie, for organizing this. And thank you for having us. And congratulations to the university leaders, all of you, for having us here. Thank you very much.
It's our pleasure, and thank you for sharing your time with us. Dr. Binagwaho, we had a question come in for you after your remarks. I'd like to interject. Someone shared that they hear your powerful argument about taking care of your own as well. And it says, I'm wondering if you believe it would be more appropriate for Americans to stay home and solve their own problems rather than be involved in projects in Nigeria, Mali, and other countries in Africa.
No, that's what not I said. The world is a big village, but don't let your people die and come to save us. That's what I want to say. There is the keeping America in a bubble didn't succeed for you. So don't go there again. You have 5 years of experience, don't continue. However, when I see the people going in the road for George Floyd, then I say they are really caring. You understand?
Yes.
And that's why it was not enough. George Floyd came 60 years too late. That's what I want to say. And I hope I'm well understood. Global mean everybody. And I have a dream, you know, Bunny. There is no human race. Something like that doesn't exist. Bunny, you are not white. You are another color. It's between pink and something. White is something very different. It's something like the panel behind me.
Mm-hmm.
There is no such existence as a white pigment. So there is no human race. So when we even go and say the black race, the white race, we are scientifically wrong, humanly wrong. In my country, there was, we solved the reconciliation by putting the right word behind the situation. We are human of one race and different color of skins. And this, if we don't think about that, and we don't think like that, we are always going to be the harm, the harm or the tool of colonialist mindset and supremacists. Supremacists exist because they believe they are a superior race. Convince them that there is no race, and their dialogue, their speech will be useless. And what a university can do is just to create partnership with equity, respect, dignity, and true solidarity, with trust and love for the humankind. And this will start by recognizing that there is no such a thing than black race, white race, and that the richness you have or the wellness you live in doesn't make you more intelligent, more respectable, and somebody we need to listen to. And also, don't listen to people because they talk louder, because those people can go on radio and TV and do it. And there are so many people who are voiceless, we are not listened to. Go dig and go and see in community who to listen to really, to have those partnerships that are really good for advancing the agenda of global health, equity, and humanity. But fight the word race. I'm another race than the dogs that I have in my garden. But you and me, we are the same race.
Wow. I don't know, do we need to probably end there. I feel like we're a couple of minutes early, Dr. Binagwaho, but my goodness, thank you so much. Dr. Sow, any closing words? Dr. Sow, excuse me.
Thank you. Call me Samba. I said that. Please call me Samba.
Okay.
What I hear. Samba means in my cultural ethnic Fulani ethnic group. Samba means second son. So actually, one of the reasons I'm really trying to become doctor and fight against diseases is because my elder brother died from some of his vaccine preventable infections. So
wow,
that's why I'm Samba. I was just accidentally became the first, but I'm actually the second. Having said that, I think I would like to still say that my sister Agnes is absolutely right, and say that we do see seeds. There are seeds of changes, and we are seeing ways out of this. And as I said, I would like to really encourage and ask UMB, the university, and all the partners to continue to build this up. I can see that you even have a global health department as part of the university structure. So make sure you communicate well you strengthen the partnership. You do that in a much more democratic and transparent, equitable and respectable way with your international partners, and also strengthen the communication and the sharing, and that's the only way. And teach that to the student. Usually we learn that after becoming doctor. So you study medicine, nobody will say something like this to you. It's not part of your exam, so you don't care, you don't read about it. And then when you finish, they send you to work someplace. And then these things will happen to you. And then you will, what can I do? What is going on? So teach this, these things, what we said here should be part of the training modules, so they know about all this before you deploy them in the field. That way, they will be able to better control it and better work this out. So thank you very much.
Can I say something, Bonnie? Is that there is a question, what UGG mean? Is the University of Global Health Equity. And during we want equity in health education or health science education, like that's the only way to get equity in access to healthcare. But what we do, first lesson, we teach that to our students. It's in the rural north, in the class is open inside the community. They see all this thing live. And we educate them through the bioscience, knowing that it's not genetic that is the problem. It's what I'm called the zip codic, because it's your zip code that is your problem. It's a zip codic disease. So we teach all this. We teach the principle of global health equity ownership. We teach history. We teach the history of Africa, the history of other countries, and we embed that in the history of the world after the Second World War, where big institutions have screwed up the future of Africa and other countries, and what to do to correct that, and to see that happening again, because the forces that are good are increasing, but the other one are resisting a lot.
So can our students come and be students at the University of Global Health Equity?
Absolutely. We have students that are coming for 1 year doing a master in global health equity or internship or 3 months of fellowship in Rwanda. Yes, we have students from Hong Kong, from Australia, from US, from Europe, many countries in Africa, of course, because we serve Africa first. But what we teach is those principles. I don't know, I ask all students, go and read where Rwanda come from and where we are. We have only $820 per capita. You have more than 55,000 per capita. And we have a better outcome with generic and HIV treatment. COVID, no death in the country the last 3 days. It's under control, even without vaccine. And we manage, because we create a resilient health system, people-centric, and using the traditional and the respect of the communities, make them part of the solution. They are not part of a problem, and health is not a commodity, it's a right. So I have to provide it. People can even sit. I need to keep them healthy as much as possible. But participation process, etc. We don't talk about those human rights that are that the high income countries are using to blame others when they don't respect that themselves, because many of those tools are tools for colonial power. So we teach all this to our students, but to do pacific change across the world where they will go.
Everywhere. Call me.
Everywhere.
We have room for them at UMB.
Please. Please
call us. We have a scholarship program you may have just heard about. We get some collaboration, and thank you both. We are very reluctantly out of time. I would love to stay and talk more with both of you. And I've gotten several messages from colleagues, not students, saying, why are you saying students could go there? What about faculty? So
we have faculty for more than 17 US institutions have partnered with us who are coming for 3 weeks, etc. And we exchange, we learn from them, they learn from us. We have faculty from Asia. We are a global platform, and we fight for it because it's in Africa with an African spirit, but a global vision.
Love it. We have a lot of people wanting to come and learn.
Welcome.
Thank you. Thank you to both of our very distinguished guests. I am blown away and very appreciative of your contribution to this discussion, which in my view has been so critically important. Thank you, Dr. Binagwaho, Dr. Sow. I'm Bonnie Bissonnette, and I will turn this over to, I believe, Dr. Carlos Ferran Guzman. Thank you.
Thank you for having us.
Thank you. That was incredibly insightful and that very eloquent, the ways that our coloniality still lives today in global health. I'm very encouraged by the work that you both are doing and have been doing. We're going to move to our student panel now, interprofessional trainee and student panel. I'm going to welcome Amy Ramirez to the stage. Amy, from here on, this is your panel. Thank you for joining us, everyone.
Thank you. I see some of our students are getting into the stage. So I just want to say good morning to everybody while students are coming on to the screen. And, you know, say thank you again to Dr. Sow and Dr. Binagwaho for your incredibly inspiring and empowering words this morning. Where we were so happy with what happened yesterday. And already I can see that today's session is going to be nothing short of powerful and amazing. As Carlos mentioned earlier yesterday, we heard from a group of students and trainees in some of our health professional programs about what decolonization means to them in the practice of their profession and their education. And today we're switching the professions and fields of study a little bit. So I have the pleasure of moderating a panel of students that includes folks from social work, public health, law, the graduate school, as well as the School of Medicine. Very excited about the interprofessional opportunities presented in this discussion today. So before we begin with some of the guided questions that we drafted and prepared in advance, I'm going to ask the students to say hello to the audience as I introduce the different learning groups that each of you were a part of, and to acknowledge the role of faculty members that were so instrumental in creating a conversation about what decolonization means within the context of their specific profession or academic field. So to start, we had two different groups from the School of Social Work. Their work was led by Drs. Corey Scheidema and Caroline Long, as well as Sally Bjornholm. Akiva and Lindsay, can you just say hello to the audience, as you'll be representing those two social work groups?
Hello, I'm Lindsay.
Hi, my name is Akiva. It's a pleasure to be here.
Thank you. Next, we had a group of students from the UMB Law School and their partners at the University of Malawi, Chancellor's College. That group was led by Professor Chikosa Banda from the University of Malawi and Professors Bill Permate, Robert Percival, Peter Danchin, and Rebecca Hall at UMB's Law School. Teoka, Sante, and Erica, will you please say hello to the audience?
Hi.
Hi, everyone. It's a pleasure to be here.
Thank you.
Hi, guys. I'm Toka. It's a pleasure to be here.
Thank you so much. Next, we had some students from the graduate school's health science and physician assistant programs, and their group was led by Drs. Ferran Guzman, Dr. Naya Wirtz, Dr. Nicole Wooten, and Dr. Kimberly Bizzle. Rose and Danielle, could you please say hello to the audience?
Hi, everyone.
Hi, Rose. Hi, Danielle. Thank you. We also had a School of Medicine group with some wonderful faculty members that were involved in the work of guiding School of Medicine students. I want to recognize Doctors Adrian Holloway, Rebecca Cray, Miriam Laufer, David Riedel, Mark Travasso, Sabina Laydorf, and Deanna Friedman-Klabanoff. Michael, will you please say hi to everyone?
Hi, pleasure to be here.
Thank you. And last, but certainly not least, we had a group of students in a learning group from the University of Maryland College Park School of Public Health. That group was led by Drs. Liz Mehring and Madhu Kuswaha. Sarah, can you please say hello to the audience?
Hi, everyone. I'm Sahra. I'm very pleased to be here. Thank you.
Thank you so much. So exciting with so much diverse representation of fields and professions and locations around the world. So I'm going to get us started. And I've got a question for Akiva and Rose, because I understand that your learning group was engaged in a very active discussion about the role of structures and systems, including perverse incentives, in maintaining neo-colonial mindsets in professional fields. In your view, what are some of the structures, systems, and incentives that support the continuation of colonial logics inside of professional fields? Akiva or Rose, whichever one of you would like to start.
I can start this off if that's all right.
Sure.
I prepared a little bit, so if I start to go on for too long, I hope you'll stop me.
Sure.
So I wanted to share about one of the distinguishing features of social work, in distinction from classical psychology, being an insistence on the person and environment, or PI theory. I think that this view of individuals and communities within and in relation to the world around them tacitly underlies a lot of the concepts that have been discussed at the summit so far. We do not, after all, consider it the fault of a person disadvantaged by historical systems and contemporary consequences of colonialism. In a historical lens, it makes a great deal of sense to people in other fields of study when this argument is material. That is, when we examine things like current wealth discrepancies that exist along racial lines in the United States as a direct consequence of generational wealth made possible by the kidnapping and enslaving of African peoples by British colonists and later early Americans. We may even extend this argument, incorporating the ideas of the social determinants of health, to explain variable health outcomes that exist along class and race lines in the United States. But this argument too is largely material. And yet our environment includes much more than the material. We exist in relation to others. And I would not call this immaterial, but amaterial. Aspects of our environment, including the air we breathe in our relationships. And because of this, there's a deep and sometimes insidious influence upon our professional behavior. This comprises the conditions that we reproduce simply by moving through the world, unless we identify the aspects we wish to change and work to do so. So a few of the perverse incentives that I wanted to discuss that came up for us: publish or perish. You may have heard this phrase before. It's not lost on any of us that there's an exciting opportunity to publish as a part of this particular conference. And I don't mean to disparage that opportunity. I hope to submit something myself with some peers. But publication is an incentive which in its nature often promotes a mindset of individual achievement, which I would say itself is a facet of capitalism in academia, which may be antithetical to a decolonial mindset. This is only one of a number of systems-based incentives. Many universities in the United States, and we've discussed this yesterday a little bit, have explicitly colonial roots, including some parts of the university system of Maryland, established in the Morrill Land Grant Acts of 1862 and 1890. I think that's U Maryland Eastern Shore and College Park. Such universities are invested heavily financially in the continuation of their existence and resist strongly any notion that they and we should engage in decolonial practices like land repatriation. We are all complicit in that from a systems perspective. And how we justify that complicity, I think, depends on us individually. And unless we organize to identify ways that we can engage in decolonial work on behalf of our institutions, we're lending our hands to perpetuation of neocolonialism. So sources for funding as well as practice is a final incentive. So we're all probably going to be involved in seeking funding for our work at some point, and those of us who've done so already are intimately familiar with how hard it is to cobble together various grants from different sources. Every one of those grants wants a little bit something different from the research that we're doing or the practices in which we're engaging. And so each one influences a slightly different outcome in the behavior of practitioners. I would say government funding in particular from governments in the so-called global north, that is governments that historically were colonizing powers and now engage in neocolonial practices, inject a kind of neocolonial incentive into projects, research projects and practices. They look for results-based research with a strong funding preference for quantitative over qualitative data, despite the value that qualitative data has, certainly in social work, particularly in elevating the voices and experiences of people who may not have those by involving their narratives directly in research rather than insisting that data can speak for itself. I want to acknowledge the theory of fundamental causes from, which is a public health concept established in 1995. The authors of it later went on to describe socioeconomic as a fundamental cause in 1998. They said that low socioeconomic status correlates to multiple adverse health outcomes and acts through multiple pathways. I would argue that this is a direct result of neocolonialism and, in my opinion, neoliberal capitalism. If we do not address these economic structures, we continue to deny our fellows in the so-called global south the opportunities that we are afforded by the colonial actions of our nations in the past. And lastly, I want to acknowledge that I've painted a little bit of a cynical picture. I don't mean to be bleak, and I insist that I am not a pessimist about social work. I have great hope that as practitioners with a desire to serve our fellows in our local communities and in our communities around the world, you join me as I demand that we ask communities what it is that they want and need, when we demand accountability from the power structures that impose a capitalism-influenced neocolonial mindset, including our own universities, and when we refuse to further commodify human need any more than it is already. I hope that I will see some of you out there as we trudge the road of happy practice and destiny. Thank you very much.
Thank you, Akiva, so much. And you are launching us right into a structural analysis. Rose, I want to ask you if you have any other insights or things to add. Akiva really set the stage for us having a discussion about the role of grant making and large social structures to perpetuating neocolonialism. Go ahead, Rose.
Good morning. In Kenya, it's in the evening, and I like the idea what Akiva, being one of the group members, what he has actually discussed. He has discussed most of the things that probably I don't want to repeat at this time. But looking at the structures, mine was a bit, what I focused about colonialism is about looking at the classical. When it comes to structures, we have the classical and the, and the settler, and the difference actually is like a circle and a line, whereby the classic will get the lion's share or the big cake, and when the settled ones will just get, they are the slavery, they are the people actually who serve on the ground. I want to give an example of a country like Kenya where I'm working, looking at how the structures are being done. For example, when it comes to like funding, the paper funding which comes through CDC, the organization which is actually my donor, funding does not come directly to the people at the ground. Funding goes through chains. By the time people are getting the, the support, they don't even feel it. There are so many people who have actually, changed things from above, and actually at the grassroots level, people are not benefiting. So the structures cannot be compared. The structures are not the same. I looked at also the system. Look at the education system and look at the healthcare system. When we talk about education system, we even have social clusters. We have those people who go, to prestigious schools. We have those people who go to, like the other schools. It's not balanced. And when you look, even the professionals, we've also encouraged that. And looking at the pre-colonial and this colonial, the history is repeating itself. Because actually, when you look at, this is a bright child, or these are bright children who needs to go to a good school, they're not being offered in terms of, they're not being offered, good education. I was looking at when it comes to, like, like, for example, I want to publish a paper. Those are educational professionals. When you want to publish a paper, you've written a journal, you've gone through that. You cannot do it on your own. You have, you have to go. We have a hierarchy that you have to start from the top so that at least your paper will be published. When you look at, how do I publish this paper? Even these journals, actually, they look at the people. Where are you are writing a paper, where are you from? Are you from the low and the middle income countries? They will even decide to give you, a journal where you're going to publish your work. You try actually to look at what you are able to do as a student who is trained, who has all the education, but nobody is listening to your voice. In regards to what Akiva said about incentives, I was looking at this incentive. And when you look, the history is actually repeating itself. Look at the developing countries. I can give you an example. We have, Kenya has one of the largest, the slums that we have in Kenya. We have so many people, the white people, they're always coming to Kenya to look at these largest slum in Africa. We have over 400 non-governmental organizations, and actually they bring aid to Kenya. But when you look at that, the slum itself, yes, we have donor funding is coming as a way of, incentives. But, it's not helping the people on the ground. Actually, the people who are getting that benefits are the people actually with selfish interests, the leadership, the political people, they have all self-interest. So the people on the ground, still, the poverty is still singing the same. And I've grown to hear about, some of these things. And today I speak the same. As much as, for example, that place is getting funding, they are not feeling it. They are not getting that, the funding directly. So those are some of the things probably I will look around that. Yes, they are getting this, but they are not benefiting. Yeah.
Thank you so much, Rose. Those are really just very important points to make. I really appreciate your comments about getting published and how much of a hidden curriculum that is for people, honestly, right? As somebody that is pursuing my own graduate studies myself as a part-time student, that's a very important point about access to opportunities to learn how to get your ideas into venues where they're going to be read about and learned about. That in and of itself is a very colonial mindset, as well as just the ways in which structures introduce money into countries, and it doesn't really have the kind of impact that we hope for people on the ground. Thank you so much, Rose, for those comments. Really appreciate it. I'm going to move next to the Malawi UMB Law Group, Teoka, Erica, and Asante. And for Teoka and Asante, we had a really fascinating conversation in the law group that one of the main points of discussion that was raised by the two of you is how legal structures are themselves based on history and precedent, which in the case of former colonies are basically inherited structures. I really want to ask you about an example about how this colonial past is creating issues for Malawi's ability to address its contemporary issues, and potentially reflect upon the role of lawyers in analyzing current laws and advocating for new laws that are more in line with Malawi's present circumstances and national identity. So if either one of you can start, that would be great.
Hi, everyone. So I'm going to take up the first part of the question, and Teoka will address the second part of the question. So I'm looking at how Malawi was once colonized, and we're looking at issues, for example, health issues. I looked at how mostly during the colonial era, the health systems or the structures that were put in place during that time, I believe that they weren't mostly in favor of the people who are being colonized, but they were advanced by the colonial rules, and they were determined by the economic and social and political requirements of the colonialist. So for us as a country to continue to inherit and adopt the same structures that were there during that time, and to continue using them in this period when we're trying to be independent and liberated, it kind of gets in the way of trying to tackle the issues that as a country we face, because the structures that the times that the people were living during that time are different from how the people live right now. So if if we're to have, for example, laws that are still addressing issues that probably don't even exist now, if we still have laws that maybe still make reference to pounds when it comes to issuing remedies and issues like that, and if we have the majority of laws not being in a language that half of the majority of the people in Malawi understands, then there's no change that we can be able to address if we're using the same laws. And I think it's one of the other issues that was raised by Dr. Agnes, that there are issues like language is still a form of colonialism, because you can't expect people to be able to address the problems that they're facing if the language that you expect them to use is one which they can't rightly articulate their issues in. So as a country, for us to, there's still some conflict between the living customary laws, and if we're comparing them to even the laws that we keep on preserving, the ones that we simply adopted from the colonial era. So the more we keep relying on the structures that we simply transplanted from the colonial era to this era, there's no way we can be able to address the issues that we face, because they're two separate, the issues that are happening in two separate areas. And for us to simply rely on the things that we were using back then, it can't really address the issues that we have now. And my colleague Teuka will address how the legal experts can be able to maybe create a new identity for Malawi to be able to use. Thank you.
Thank you. You're muted, Teuka. Teuka, you're muted. Can you unmute?
Apologies for that. Hello, everyone.
Hi.
So let me perhaps begin with a famous quote in legal circles by Reynold Strickland, who once said that lawyers are foot soldiers of the Constitution. But can every country really, especially those in the global South, truly call their constitutions theirs? Can Malawi call its constitution hers? You know, Santi has given a very good example of inherited legal structures and how these pose a problem. And of course, this has been acknowledged, and now we have law reform agendas. But even when we critically examine the law reform agendas, can we truly characterize them as being free from colonial ideologies? Who sets the law reform agenda? Where is the money coming from? Why is the money coming? Is it in good faith? Can we call it charity? Charity without ties, without expectations, without Western ideologies? I think not. What are the legal principles that are permeating current legal thought? You will find that Western ideology is still so predominant in legal thinking. And so in a sense, current laws and even future laws can best be characterized as a form of neocolonialism. And the problem is multidimensional, because on the one hand, we have substance of law that has colonial and neocolonial tenets, but also on the other hand, the application of the law itself is characterized by procedures that do not best reflect the context. And so lawyers can play such a critical role in ensuring radical law reform, but also shaping how law is applied. Lawyers are in such privileged positions to engage with laws in varying contexts. The opportunities that lawyers have to apply laws in varying contexts are such unique opportunities so unique and particular to the legal profession, you know, to observe and to examine the relevance of laws. Lawyers need to be trained to be conscious of neo-colonial realities, to challenge status quos instead of just accepting existing privileges and power structures, and even to take steps further to advocate for change, including the review of laws. And I know it sounds good, but it's not the norm. It may not be dignified, but It's high time that the Global South needs to step away from its historical categorization as the other in global matters. You know, conversations such as the one that we're having now are so critical, yet so rare. Lawyers need to be on the forefront of rethinking and redesigning legal education and training, the substance of laws, the way laws are applied in practice. Lawyers just generally need to be on the forefront of creating legal discourse that can generally be characterized as being relevant to the Malawian context and whatever context the laws in question are likely to be applied. So that's pretty much it. Thank you.
Ilka, thank you so much for that comment. And you segued me beautifully to the question of education, because I totally agree with you. Like the structure versus human agency problem is like the perpetual problem that we're talking about here. And how do we create the grassroots conditions inside for structural change is very much, I think, a question of education. So I'm going to transition to Erica here and ask you a little bit about your experience as a student in the collaborative course between UMB and Chancellor's College. This was a really fascinating course, in my opinion. So if you could tell us briefly a little bit about the topic and how it was particularly unique for you as a law student in terms of your experience in that course. And what do you think is the role of courses like this in the project of decolonizing global education?
Thank you, Amy. So great to be with all of you today. I really found this course, which was focused on environmental justice, human rights, and public health, to be incredibly fulfilling. And I'm not just saying that because I'm on this panel. It was really probably the most moving of my legal education so far. It was designed really effectively in that it was multidisciplinary and brought together speakers and educators across all of those topic areas: environmental justice, human rights, and public health. And each of those areas involve complicated and different values and legal principles. But in the context of Malawi, the health and well-being of the country is inextricably linked to environmental degradation and access. So in order to develop one and enrich one, you really have to take into account the others. The course, I think, reflected that interdependence, and in taking this approach also allowed more opportunities for us to consider the country's past experience with colonialism, as you've heard from some of my colleagues today, and how that impacts its approach toward health and the environment today. Just as importantly, the course was co-taught with Chancellor College in Malawi. So in addition to gaining this multidisciplinary knowledge, we learned firsthand from professors and students in Malawi who were wonderful and gave us deeper insight into the country's culture and value system. And I think that helped us to brainstorm really viable solutions. In my impression, this type of course helps to advance the field and decolonization within the field, because it brings together a variety of voices from different backgrounds, both from a topical perspective, but also those from different countries and even backgrounds within those countries, and engaged us in meaningful conversations where everyone felt free to share and be vulnerable in terms of their views toward the different topics. And in my view, that almost always leads to better and more inclusive problem solving. And then certainly for our US students, it was important to better understand global inequalities and remnants of our colonial past, both in Malawi and in the US. I would say that a more narrow approach on one sector or issue could not have captured the complexity of the challenges and opportunities that Malawi faces, nor the issues of environmental justice more broadly in such a way where we could actually develop tangible and creative solutions.
Thank you so much, Erica. Like, in a nutshell, what I really hear you saying is how important the interdisciplinary approach actually really was to this course, as well as like really hearing from students in that context and like taking a deeper approach to understanding the very nuanced and sophisticated issues surrounding context is just so important to the work of building equity and advancing more equitable distribution of resources, new systems, and to our own collective learning, which is just so powerful. Thank you so much, Erica. I really appreciate that. I'm good, and I feel like you've sort of set me up well for my question with Lindsay from one of the social work groups. And one of the topics that I heard discussed in your group was really the notion, and in other groups as well, was really around the notion of expertise, and particularly how do we decolonize expertise and incorporate what Dr. Long characterizes experts from experience into professional education and practice. Go ahead, Lindsay.
Thank you so much. I am going to share my screen. I have a very, very brief presentation. Let me make sure you can see it.
Thank you.
Can you see that?
Yes, we can.
Okay, great. Thank you to everybody who's already shared. I mean, yesterday and today, it's just so enriching and has kind of re-maneuvered our conversation and outline. So thank you. This has been just an awesome experience. So as you mentioned, we worked with Dr. Caroline Long, Sally Ann Bjornholm, Brooke Bainham, Bryn Herrick, and myself. So this will definitely have some continuity as all the questions have kind of naturally led to each other. And Akiva did a great job in capturing a lot of the social work principles, so especially in education. So in the interest of time, I don't want to be too redundant, but yeah, just the role of academic institutions in deciding who has that expertise and who doesn't. So just bringing awareness to the classroom to challenge that frame of thinking and recognizing the white-centered curriculum and policies. So integrating those topics of oppression, colonialism, diversity, and resisting the temptation to assimilate students to the current culture of higher education, and instead empowering them to thoroughly critique these standards. So, having them be very, very critical of everything they're learning and not accepting the status quo and being an agent of change for that. One of the things that UMB does really well is I just finished my foundation year, and we began our foundation year with a structural oppression course. And that really helped before we got any further to set the historical context and really explain and do a good job of seeing through the lens of power relations, privilege, colonialism, systemic racism. So it was really, really helpful for myself, especially as a clinical student, because it's so applicable to both specializations. Another thing that's important for educational institutions is to collaborate with global colleagues in genuine partnerships, foster those relationships, even though they may take time and investment, which isn't a very quote unquote Western way of thinking, really making that investment because we like the quick results. But supporting interprofessional global education that goes beyond this medical diagnostic model. And then especially in social sciences, teaching about changes in research methods over time, especially as it relates to different types of data. So like health disparities, and Akiva went into the value of qualitative research when we're so quantitatively based. So, and then as an individual commitment, as a student, just dedicating oneself to a lifelong learning of self-awareness, recognizing the impact of their or our social identity and our position in practice, understanding and dismantling that privilege and strengthening our cultural sensitivity, and this continuous self-appraisal of our own scripts and implicit biases. And let's see, I'll go to the next slide. So even beyond the classroom, starting all the way at the top, the discrimination it's with institutional leadership. We have a code of ethics in social work, and that in and of itself, even though it's an international code of ethics, lacks, fair representation. And it's based on Western views and individualistic values. I put Western in quotes because I learned yesterday that that's not technically, we should be turning the term or changing the terminology. So I'm constantly learning and unlearning, what's right and what's wrong. So that's just, I don't have another substitution to use just in this context to get the point across. But the patient-centered model is not necessarily generalizable cross-culturally, and that's a very individualistic way of viewing things. And many of these communities are interdependent. They don't see themselves as very separate from their environment, and it's hard to isolate those conditions. So we really need to build genuine relationships and work through, as Akiva mentioned, the qualitative data to understand what they believe the issues to be, what they want help with, instead of assuming we know. That's a very missionary white way of thinking. Let their voices set the objectives and the goals of the work, because we value, going back to funding, as others have mentioned, like we value the results, instant outcomes, scientific method. That's what determines the funding and the agenda and how the results are presented. So, whoever's pushing that process, who's sponsoring the study, who's going to benefit from the results. So just keeping that in mind and really valuing the qualitative and anecdotal, research from the beginning to move more towards the, results that we're trying to, the evidence, and increasing the integrity of the evidence, as Dr. Sow mentioned, because that's what's going to make it the most efficiently, maybe not efficient, effectively actionable, because we're getting the evidence from the experts. And I'll go a little bit more into the experts. And then one quick thing is that psychological research, and social work, which is supposed to reveal truths about human psychology in general, it really only captured, at the beginning at least, a very thin slice. It's people who live in Western, educated, industrialized, rich, democratic nations. So they call that WEIRD, W-E-I-R-D.
Yes.
I didn't change slides. This is my social work as a profession that I just talked about everything. So here's a little summary. But yeah, I like the WEIRD nations, because really that helps us to evaluate where the research is coming from and who it applies to. So that is that slide. Let me remember to change slides this time. So now bringing us to practice. We were encouraged in one of yesterday's sessions to think of culture, history, legacy of our particular profession or discipline, and how that impacts how we learn, interact, and trust information. So social work has a history of hegemony, or what might be called professional imperialism in other countries. And that's, again, sharing our values as best practice, assuming that we know what is best based on our value systems. So a good way to counteract this and challenge this is to look beyond the clinic and into the community. So some of these conferences held are in a completely different region and the problem exists, right? And so the Global North is deciding what's best for the Global South without even incorporating them into the conversation. It's also important to understand what culturally appropriate means and who is setting that norm, because there's gatekeepers within those communities with power and leaders and values tied to money, so that they're affecting what people believe, and people might not believe that they need help because of these, for example, gender constructs. I'll go into that a little bit later. But so this experts by experience notion in social work and interdisciplinary education are much less common in the US than other countries, particularly in roles of authority. And so in the US, they mostly serve in advisory capacities. So we really need to bring in the lived expertise on authentic conversations, diversity, firsthand knowledge about the enablers and barriers to successful outcomes. So this was brought up earlier this morning, but they need to be treated the same financially, level of respect, understanding, dignity, in order to have those conversations and bringing everybody to the table. So as a decolonization strategy, we recommend these experts by evidence in significant roles, teaching, decision-making, manuscript preparations, research, funding discussions, IRB panels, and really amplify and value their voices instead of using the external forces to guide the research. Community-led monitoring can help with this. For example, PEPFAR and USAID are some global health examples right now who are really working towards that goal. Working with the community instead of for them. So helping them find their voice and then supporting them to create change. And again, time is required for these relationships in order, to make sustainable changes. And then qualitative research is important, as we've kind of gone over. So the what now? What do we do now? That's a big question of the day, right? So it's a balancing act. And in social work, in general, there's always like this battle of finding the balance between macro and micro, because if you're solely focusing on micro and clinical work, then you're kind of feeding in and perpetuating that, blaming the victim mentality and ignoring the larger systems at play. So macro, alternatively, you might be looking at the overarching policies, but you're not necessarily helping the people, on the street level who need help right now and the immediate benefits. So balancing health equity with the human rights framework is also really important. So helping those that you're trying to help to be involved in the macro level goals and priorities and helping them set those agendas. One interesting topic, and I'll close with this, we talked about how the oppressed might not realize they're oppressed or want to seek help. For example, women who are comfortable with their role or, have always seen it as appropriate for men to be leaders. So if there is a system of oppression, it's the duty of the social work practitioner to empower the oppressed and break the system by helping them to do so. So that's where the grassroots efforts come in. And then think about why they find these practices to be culturally appropriate, and then who instilled these beliefs and norms in the first place. Actually, this is my last thought. So Dr. Opera so eloquently yesterday explained the broader concept of, decolonization of the mind and liberation beginning with imagination and looking within individually and institutionally. And with social work in particular, it's important to recognize that this decolonization not only refers to removal of the domination of external forces, but also the decolonization of the mind from these ideas and what makes them feel inferior. And this entails authentic conversations as well as rigorous self-inquiry in order to help the clients in the population work to change their inner narrative and their narrative as a whole and empower them to create and sustain change. So those were the most concrete suggestions we could give based on this conversation. So thank you so much for letting me share.
Thank you, Lindsay. Really appreciate it. I'm going to move on briefly to Sarah, who is the representative of the public health group. And I understand that your conversations there were very engaged in a conversation about menstrual justice and the relationships between colonization and gender inequity. What can decolonial movements learn from struggles for gender equality? And how does gender equality interact with decolonization as you see it, Sarah?
Thank you, Amy. I would like to first thank you, our team, and Dr. Elizabeth Moring and Dr. Madhu Kushwaha, and my peers, Rava, Sarah, Sudan, and Akbar for their inputs during a workshop that we had last week. We had a great conversation, and I hope to convey some of the points that we discussed as a group, as well as some of my own personal opinion about menstrual justice and decolonization. I will first speak briefly about the issue of ministerial justice, and then I will discuss how gender equality interact with decolonization. And I will keep it specific to my topic since I think the general concepts have been already very well explained and discussed. I loved Lindsay Wanger's presentation. That was amazing, especially about talking to focus on structural changes as opposed to blaming those who are already in need. So ministerial justice is a significant public health issue around the world, especially in the global south. Students drop out of school or miss school during their menstruation period. For example, in India, 1 in 5 students drop out of school, and in Afghanistan, it's about more than 1 in 2. While for some it's due to a stigma, for others it's because of the lack of poor toilet and other facilities in the school. Because of the stigma and practices that has institutionalized menstruation as a taboo topic, women and girls are less likely to practice proper hygiene and seek help or medical care when they need, and therefore are more likely to be diagnosed with other severe diseases, including cervical cancer. Even in places where it's not taboo to talk about menstruation, there's still a lack of awareness among men in families and the society at large. In countries where women work on the farms all day, do not get to rest even though when sometimes they are bleeding heavily and are in need for taking a rest. There also exists unequal access to sanitary products such as pads and tampons, and many families around the globe cannot afford to buy those products. And finally, again, the stigma, shame, and some other unjust practices has really exacerbated patriarchy and consequently increasing gender inequality. So our group also discussed the fact that although the Global South doesn't like interventions that are condescending and undermines the culture of the Global South, this does not mean that the Global South is okay with gender inequalities and doesn't mean that they do not need help. We, the Global South, I was born in Afghanistan, and so we do need help with building our capacity. However, interventions need first to examine the community context, sociocultural norms, and power structure. And second, to engage with community and religious leaders and build the agenda with them instead of going with an agenda already created. And I think Lindsay has already done a great job of explaining this. Also, furthermore, when the Global North attempts to assist the Global South in reducing gender inequality, they also need to understand the historical context of that country. And as an example, and this is going to be my last example, and I'm going to talk about Afghanistan because that's the country that I was born in and I know very well. And just to give it an exact example of why it's important to understand the historical context of a country before intervening. So in Afghanistan, majority of women do not have basic rights like getting an education that's only granted to men, and 56% of women experience spousal violence. But this does not mean that Afghan men are innately violent. Before Afghanistan was invaded by the Soviet Union and by the US, which was before 1970s, women in Afghanistan had the same freedom and rights as women in the West. Had we not experienced colonization, invasions, and war, we would have developed the same way as other developed countries have progressed. But the invasion, colonization, and the continuous war has created a structure of violence, which is defined as indirect violence built into repressive social orders that can shape people's self-conception, behavior, and practices. Conflict also robs people of opportunities for education and employment, leading to poverty, inequality, oppression, and stress, all of which induce gender inequality. For developed countries to intervene by implementing short-term programs or establishing laws that support gender equitable laws are not enough, especially when those laws are not enforced. There is a need for empowering those countries in the Global South and building their capacity and providing them with resources so that they can become independent and stand on their own feet. And the Global North, you need to do this with a decolonizing mindset and with an active involvement of the community members. And then I want to conclude by saying that not all interventions and help are malintended. There are certainly countries and organizations that have genuine interest and goodwill in helping other countries in need. We just need to bring awareness about the way the Global North approaches Global South, and just to be very careful about the nuance of being more sensitive to the cultures, being more aware before we step in there, because again, even if the intentions are good, but if it's not approached properly, then the people in the community will feel, they will resist basically, and will be feeling, like condescending and which is something that we do not want. So I really like to emphasize on the aspect of bringing awareness and really engaging the community. Thank you.
Thank you so much, Sarah. Those are two outstanding points to reiterate for us, because it really does speak to the role of really trying to understand historical legacies, but also really trying to think hard about how we are present in communities around the world, right? And really thinking about how we listen deeply to voices inside communities to learn the best ways to do things in that setting, which has been a through line across the summit. Thank you so much. So I'm going to transition now to the School of Medicine and the physician assistants representatives, Michael and Danielle. And I understand, I was in the PA session, I was not in the School of Medicine session, but I understand that both of you spoke about a particular scenario about short-term experiences in global health. Dr. Opara really called out the use of the term medical missions in yesterday's panel, so let's be mindful of our language. But I understand that you had a discussion about the role of these STEGs, if you will, and the ethical conundrums that come up around the presence of international students and trainees and organizations in limited resource settings. So I'd like for you to share your reflections about what some of those ethical dilemmas are and what you would say students, trainees, and universities can do to advance greater equity and think about their role inside of low and middle income countries. Danielle, I see you're unmuted, so if you'd like to kick us off, go ahead.
Sounds good. Thank you, Amy. And thank you for everyone who's presented today, such powerful topics. First, I want to thank Dr. Kimberly Bazell and Professor Nicole Wooten, who were our faculty advisors. And I'm also speaking on behalf of the PA program. In our group was Alex Berinsky, Dorian Hoffmeister, Francesca Mertan, and Tiffany Ligon. And we just have to say and be upfront that many of us in our group are guilty of this. We had gone on mission trips. However, we did realize after we went on our mission trips that we tended to get more out of it than we gave back to the community. And yesterday, as many of the panelists spoke and experts spoke, that we're actually doing more harm by these mission trips than doing better. So I will touch on that. But one of the main dilemmas we first discussed was how mission trips, and I'm going to use the term just kind of classically here, they're pretty unsustainable. So we use the term a Band-Aid to represent how these trips provide a short-term fix, so we think, to the larger problems at hand. So the bigger issues here are the lack of resources, be that human or physical resources, and the inability of many in these remote communities to travel to cities that actually house most of the healthcare access for their country. So we're trying to discuss ways to promote sustainability in these communities. So instead of coming in and acting as pseudo healthcare providers for a week or two or three, and then leaving and stripping the communities of the human resources we had just provided, we really thought it would be better to establish training programs and mentorship programs. So therefore, we can leave behind the skills and the knowledge that we as students or, as doctors or PAs have learned. So initially how we see these programs going is first establishing partnerships with other universities and communities in the Global South to really build relationships and truly understand their culture, their current healthcare system, their healthcare roles, and the needs of their community. So we are one step in this direction with this conference and the conversations we have had during our pre-summit workshops. So I really thank UMB for that opportunity. But we do need to go a step further and continue to collaborate with our partner programs in order to empower them and empower the locals to set up sustainable training and mentorship programs suited to their needs. And what this does is it also tackles a part of, we can be part of that conversation here in the US so that we are still learning and becoming culturally aware. So this could really start with simple mentoring. So a discussion I was a part of with the Maryland AHEC, or the Area of Higher Education Center, was the importance for children, the future leaders of the community, to see and talk to people of similar color and background in healthcare positions. So we could partner with the universities and communities to help start the discussion and establish formal mentorships so children of local communities can learn about the path into medicine and become passionate about giving back to their own communities through medicine if they desire. So therefore, we're still part of the discussion, but the children have a more realistic outlook and understanding of healthcare in the communities. And this could potentially increase a generation of healthcare providers, and that could tackle one of the big issues at large of getting more healthcare providers who understand the community and stay in the community. As for the training portion, we didn't want to jump too far ahead with how we see this initiative coming to fruition before really engaging with the community, as what we've learned through our workshops and through this summit so far. But we really think is important to consider is, one, who we train, and two, what skills or knowledge we can train. So that way the people can safely and adequately care for their people. So for example, I have a mentor whose family still lives in India, and he told me he has an uncle who is a doctor of his very remote community, hours away from the city. So the reason I put this in quotes, that this man is not officially a doctor. He never went to medical school, but through lived experience and through informal training in the city, he was able to come back to his community and care for the lower acuity patients. So he understands their culture. He understands what medicine they believe in and what medicine is best suited to tackle local prevalent diseases. But he knows his limitations of who needs medicine. And this brings me to my next point. Whereas physician assistant students, we believe strongly in challenging the hierarchy of medicine. So our PA profession was founded because people in the US Coast Guard were trained to provide healthcare on merchant ships during World War II. When they returned after the war back to the US realized we could turn their training or their lived experiences into a culturally and legally accepted healthcare profession. Since the start of the official PA profession in the 1960s, the profession has made amazing leaps. However, the Maryland Board of Physicians is now, and I mean now to this day, recently, this year, is trying to limit our scope of practice, restrict what we can and cannot do. But for what reason? To maintain the hierarchy? Are patients being harmed? And we really think that, and I hate to use the term ego, but at some point, some people want to maintain this hierarchy. They want to maintain their power. They don't want to lose the power they have on the medical system. And actually our UMB AACC Assistant PA Program Director, Professor Teresa Newman, was fighting for the hierarchy, or to dismantle the hierarchy, last week with the House of Delegates to fight for the future of our profession and fight for our school's mission of producing providers to bridge the healthcare disparity gaps. So limiting PA scope of practice will ultimately unequally harm those in underserved areas who already have less access to healthcare. And in yesterday's discussion, Dr. Dania spoke about this healthcare hierarchy that stems from the consequences of colonial mentality, where physicians are the highest source of medical power. They are the bosses. And yes, we respect a physician's level of education, their commitment to medicine, their role in medicine. Their expertise in distinct specialties is critical for many people, especially patients of higher acuity. However, as there is an ever increasing need for healthcare providers in the United States due to the increased multiculturalism and the diversity we're welcoming, or in the global South where people are still dying from many preventable diseases, we want to challenge this hierarchy. We need to reshape our healthcare systems in each country and in each community to promote increased access to affordable healthcare.
Thank you so much, Danielle. These are all very powerful points. I want to give a chance for Michael to chime in and also talk about what the School of Medicine group was talking about. And I know you have some insights on this from your work in Samoa. So Michael, please go ahead.
Thank you so much, Amy, and thank you to each of my colleagues who have spoken before me in this panel. I've been taking extra notes and saying, okay, I need to cross this out. It's already been said so eloquently and well. So I will add only brief comments in the interest of time, but to emphasize a few perspectives that are not unique to medicine in any way, but something that we start with in our curriculum. On the first week of orientation, we talk about medical ethics, and four that our pillars in medicine and across all these fields are autonomy, beneficence, non-maleficence, and justice. And these hold true in our education and in our practice, hopefully and ideally, but at some point sometimes seem to leave when individuals leave the system in our country. And the scenario we talked about hits upon all of these. I won't summarize the scenario in its entirety, but essentially a second-year medical student paying a large sum of money to do a one-week trip to Johannesburg, South Africa, where they worked for a made-up organization called Help the Hurting. And when they returned, they posted about it on social media about how it opened their eyes and changed their life, and et cetera. And there are very clearly systemic effects of colonialism and neocolonialism on this scenario. And unfortunately, this scenario persists in many examples today. A few points that we pulled out were, for example, predatory branding. The name of this made-up organization that is very representative of many, Help the Hurting, focuses on a deficit-based unilateral action where you have this savior coming to help. And it preys upon sort of the interest in all medical professionals across all allied health fields to help. That is part of our training, but not necessarily in a fair way in this example. With a student paying very high costs, the question that was very eloquently brought up by Rose early on is, are these funds reaching the people on the ground? Or is there some intermediate party with self-interests? Why are the costs high for a student to visit for 1 week? And the student, while they were in Johannesburg in the scenario, performed procedures for which they were unqualified, such as delivering a baby under nurse observation, which they never would have done in the United States. And so there are questions as well around that. But I think a more salient point that is extremely important brings about the danger of a single story, as so eloquently put by Chimamanda Ngozi Adichie. And she talked about how one perspective, one moment, one story will not be beneficial in the long run. And this student, after returning, saying how it changed their life, this one experience, it's not representative of Johannesburg, a single clinic that is in desperate need, having students performing procedures that they should not, is not representative of probably the dozens, if not hundreds of other excellent healthcare outlets within Johannesburg and local efforts that are trying to improve. And the fact that a student would attend or arrive and be completely surprised by conditions at a clinic really shows a lack of preparation on the organization side to make sure that that student is truly aware of what they're going to be working with. And to sort of wrap up our reflections, the most, I think, important question that came up was prompted by Dr. Fayron Guzman about the potentially detrimental good work, the potential detriments to the good work of a clinic and the physicians and nurses and staff, clinical staff who are there all the time and not coming and going. And Dr. Danya Kato yesterday remarked on the ethos of better than nothing, questioning whether, is this better than nothing, you know, spending this money and going for 1 week. And there are detrimental long-term effects on a local ecosystem, as she so eloquently put it. And most of those times the ecosystem is ultimately cared for by years of hard, slow, incremental work by local leaders, not by a 1 week experience for a student that returns and the major reflection is that it changed their life. So to summarize a few, I guess, specific, I think, attitudes that students, trainees, and universities could put into practice, I think Danielle put a lot of excellent points out there that are actual structural changes that could be put into play. So I'll take the side of some attitudes. We feel, you know, a student should put it upon themselves to prepare. Like Dr. Opara said, ask why 5 times and be prepared with the humility to not know the answer and the humility to be in a position of learning from someone, even if you do not know their educational background or their experience. They are there and they have been there before you. So you must go with that humility. And that's an attitude that can be cultivated through academic programs in your local institution. For example, in the School of Medicine, we have service learning, and service learning is not just the hours put into it, but it should be the development of that Y times 5 at least. Seeking research projects can oftentimes be more beneficial than a 1 week clinical stay, because a research project requires previous literature review and understanding, bringing some small skill set that's beneficial, ideally at the request and at the behest of the local organization, and then follow up and working through it after the fact that you leave and continuing to contribute back in that circle versus a line that was discussed. And at the university level, going all the way back to Dr. Ward's opening remarks, I think he put it great, celebrating the richness and expertise of international students, scholars, and faculty can be actualized in so many ways that Danielle and Lindsay discussed. So I will leave it there. I know that we could discuss this much further, but in the interest of time, thank you all for your wonderful, wonderful remarks.
Thank you so much to this amazing panel of students. I'm beyond proud and grateful to have learned from all of you in the last hour, and I'm sure our audience feels the same. I think I'm going to transition us back to Carlos, if I'm not mistaken, but I want to say thank you, and this was just an amazing and inspiring panel, and I'm looking forward to building on the ideas that we've advanced here today. Thank you.
Thanks, Amy, and thanks to all the wonderful students and trainees and for this amazing remarks and their perspectives. I know there's a lot to react to, so I'm gonna call a 10-minute break. We'll get started at 11:20 sharp Eastern time, 9:20 my time here, and I'll see you soon. So stretch your legs, and we'll have a nice, I don't know if we're gonna see jellyfish today, but we'll see what surprise we have for you. All right, thanks to everyone.
Hello, everyone. Good morning or good afternoon. And I think for some people it's really late at night. So I welcome you all to this summit and really want to thank the students for their amazing comments and thoughts and reflections and for allowing us to learn from you. We're so grateful and looking forward to having the Reactor Panel react to all the great points that you made. So I'm going to ask Professor Fleming and Dr. Olson and Professor Yamin and Banda to open their cameras. I'm going to do a very short introduction because we have, this time is going to fly. There's a lot to react to. And we have a hard stop at 11:50 my time when Dr. Perman, the Chancellor of the University of Maryland system, will come on to close the summit, which has been so wonderfully successful so far. And hello, Professor Banda in Malawi, thank you for joining. It's great to see everyone. So just with some quick introductions, starting with you, Professor Shani Fleming, who is an associate professor at the University of Maryland, Baltimore Graduate School. She's an executive team member of the Physician Assistant Leadership and Learning Academy, PALA, and although I understand it might be the Physician Associate Leadership and Learning Academy, and the Graduate School's Equity, Diversity, and Inclusion Officer. Thank you so much for joining. Dr. Jody Olson, hi Jody, recently served as the 20th Director of the Peace Corps, overseeing among other wonderful things, overseeing the difficult return of 7,000 volunteers at the start of the pandemic, who are now slowly making their way back. And of course, many on this session will recognize her as the beloved visiting professor at the University of Maryland School of Social Work and the founding director of the UMB Center for Global Engagement, which is sponsoring this summit, one of the sponsors of the summit. Chico Sabanda, an old friend, is the Dean of the Chancellor College Faculty of Law in Malawi and a senior lecturer at our own University of Maryland Carey School of Law. And he's co-directs the teaching partnership between the two schools that you heard about in the previous panel. And finally, my old friend, Alicia Yamin, thank you for joining. Alicia is a lecturer on law and a senior fellow at the Petrie Flom Center for Health, Law, Policy, Biotechnology, and Bioethics at Harvard Law School, and senior advisor on human rights at Partners in Health. And there are much more extensive bios for these wonderful reactors on the Summit webpage. So I just wanted to share their short titles. So it's great to have all of you here. There was a lot that you just heard, much to react to from the students from medicine and physician assistant, public health, social work, and law. So I guess I'll start with you, Alicia, if you don't mind being the first to react. This is a summit that's quite different in the sense that we're hearing from students. So though you were all experts in your field, we're centering students in this. And did any story or reflection stand out to you and relate to your practice as a lawyer and public health expert? What reflections stood out to you the most and why?
Well, first of all, thank you, Virginia, for inviting me to be part of this. And it was really a great pleasure to listen to the students' reflections earlier today. It's really just a wonderful initiative and wonderful event. I wanted to give a couple of reactions. I do teach at Harvard Law School. I also teach in the bioethics program at the medical school and at the School of Public Health. And I've lived for half my life in South America and East Africa. So from a little bit on two comments, one from Teuka, and I hope I'm not mispronouncing your name too badly, on laws, and then another from Rose on health and health systems in Kenya. So from the law comment I thought was really, it was really very articulate and important, the comment she made. And Malawi has been a center of external engagement in drafting of laws. I am very aware of 2 countervailing tendencies on abortion law reform and movements. And I think the point she made about owning your own constitution and creating your own framework for democracy, really. That's what constitutions do. They design democracies, they set out our fundamental commitments. And the extent to which that is affected or distorted by external actors, I think is something that has gone on for a very long time, obviously, and there's a tremendous legacy of colonialism in many countries' legal frameworks. But it's something that we don't talk about enough when we teach in law school, in terms of theories of law and what that means, and constitutional reform moments and processes. So that was really, really kind of hit home and resonated with a lot of things that I've worked on in my life, including constitutional reform in Kenya and the implementation of the wonderful constitution in that country, as well as now in Chile in South America. On public health, I really thought what Rose said was, again, very kind of striking and absolutely true about the amount of donor engagement and funding to do projects, and how little of that money and how little of the benefits redound to people in Kenya and to Kenyan scholars. And I think there's a real agenda that she pointed to on how in public health so much research actually ends up harming people in certain countries, how the agendas themselves are set up without participation or really meaningful engagement in countries, and the benefits of that scientific progress that are produced by research are often not shared. And that's obviously something that we're all aware of now with the COVID vaccine debate. So I'll stop there, but I thought both of those remarks really touched on things that I have found very true in my own experience.
Thank you so much, Alicia. And Chikosa, as the Dean of the Law School in Malawi, and you and I have worked to create the joint program between the Law School, University of Maryland Law School, and Chancellor College in Malawi. How does the course that you co-created that was also, I might add, one of the few courses that went on during the pandemic because it was already online. So that was quite a success story. How does that address the concerns that your law students, Asante and Teuka, brought up? It looks like you're unmuted, Chikosa. Did you hear the question?
No, I suspect you have muted yourself. So that's what I wanted to say.
Oh, good, perfect. I can hear you perfectly.
Yeah, but I didn't hear your question.
Sorry, my question is, as the co-director of the joint human rights course between University of Maryland Law School and University of Malawi Chancellor College of Law, does that course that you created go some way forward in addressing some of the concerns that Professor Yarmin just brought up and your law students, Teuka and Asante, brought up?
Yeah, to some extent, it does attempt to address those concerns. because what the program does is to ensure that students interface with the communities and understand how the law works or operates in practice. Unfortunately, for this year, that did not happen much because of the COVID-19 crisis, but the idea is to make sure that students reorient themselves to the way the law works and to ensure that they understand the law in practice and they understand the law from the perspectives of a different culture. Because I think what we have had as a key challenge, as the students said, is that most of the laws that we have were inherited from colonial masters, and they were assumption laden, in that the assumption was that the systems from the north or from the west were superior, while the traditional systems and processes were inferior. So the way we have been training our students is that we've been training them from that Western-centric perspective. And that has been a major problem, a major challenge. So what we are trying to do now is to allow our students to interface with the communities so that they can understand how the communities work, how the communities resolve their disputes, and how the communities regulate their lives. So what we wanted to do is to get both students from Maryland and Malawi to understand environmental and public health issues from a particular area and a particular community. The idea is for them to understand that communities have their own ways of addressing issues, have their own ways of addressing problems. But what we have so far is like the received law that we received from our colonial master is taken to be the ideal. Whatever developed from within our own communities is looked upon as inferior and can only be tested against what we think is the Western ideal. So in short, I think the interface of the two cultures of our students and the idea of the students engaging with the communities, trying to understand the way communities operate and try to understand legal solutions from the perspective of communities is one way of addressing the problems of colonialism. The idea that communities and African societies have had systems that work. What we have now, as I said, is, for example, if you're talking about public health, if you're talking about law, if you're talking about other systems, we always look upon our systems as inferior and the systems from the West as superior and worth emulating, even where we have systems that work very well and that the West can learn from. And the other idea behind the course that we have been offering is also I think it also addresses some of the issues that the students raised. For example, dealing with the savior mindset, where sometimes institutions in the West look at Africa, for example, as a place that needs help, as a place that can learn from the West. Yes, indeed, we can learn from the West, we can learn from Western systems, but the West also has things to learn from us as Africans. There are certain things that we do better than the West, and there are certain things that we do better, that the West does better than us. So we are talking about a system of mutual learning or a system of mutual dependence instead of a one-way process where the West comes to Africa as saviors and Africans are recipients of Western benevolence. Thank you.
Thank you so much for that, and really focusing on that, the value of bidirectional learning. And I realize a single course can't address what is such a deeply rooted problem that really has branches into so many aspects of colonialized society. But I really applaud you for your work in developing that unique class with our law school. And the structures that you talked about, that in a sense you're talking about structures that need to be reflected on and dismantled, is something, Professor Fleming, that your student Danielle really poignantly referred to in her comments. So I wanted to move to you and ask what really stood out to you, and what are some paths forward for either the PA profession or generally for the university.
Thank you, Virginia, for the question, and thank you for the invitation to be a part of this amazing summit. So I love the focus on these short-term experiences in global health. So I want to make sure that I use the appropriate terminology, and the self-reflection that Danielle was able to really share with everyone. And a couple of points around that. I thought it was interesting, the intentionality around having that conversation, because I think that oftentimes self-reflection doesn't necessarily happen on its own, and creating this space. And so kudos to you all for creating this space for these students to be able to have that self-reflection, to be able to ask those questions and to be able to come to that conclusion. So I'm really appreciative of that. And really, I think that as we move towards solutions, really having more intentional spaces for self-reflection, I think is going to be key. As I sat here and I was, and also reflecting on those statements, it really brought back this notion of how systems and structure create the products that they are intended to create. And I felt, when I'm thinking about sitting on admissions committees and having these PA students come in, and how folks really get extra points or a leg up, right, for having these short-term experiences in global health, and how we really are just perpetuating a lot of these sort of, these sort of false narratives, and actually giving more credit and to the same structure. So it's a really fascinating example of how the system is, perpetuating the thing that we're really trying to dismantle, and the notion of these short-term experiences and who has access to them. Our profession, as well as many other professions, is a predominantly white profession, so about 88% white. And thinking about folks who have access to these short-term experiences and the social capital that are afforded to many of these students, and how that's also really continuing to create that gap that we're seeing within our profession. And Danielle did a really great job as far as thinking about sort of hierarchy of professions when talking about the Maryland Board of Physicians and how, as PAs, so we're physician assistants, but yesterday we had a name change to physician associates, so PAs. How PAs, we really are a critical member of the healthcare team, and have continued to have to fight for, our role within this hierarchy. And that is true, but what is also true, and so that's sort of an externally facing fight. But what's also true is, I think as a profession, we really don't do a lot of reflection internally on the hierarchies that are set up, and how our profession is so incredibly white, and across health professions is so incredibly white, and still centering, really sort of that white as the center of a lot of what, based on our academic medicine and how we're actually practicing medicine. So I think that there are opportunities for us to also do some internal reflection and some critical appraisal of ourselves and of our profession, the same way that we are able to sort of externally critically evaluate our profession. So those were just some of the thoughts from that brief experience.
I appreciate what you're saying so much, and it really follows up on Dr. Binagwaho's earlier comments during the keynote that global health is everywhere, and we have to really look at our assumptions internally, externally here, and how they relate to our work overseas with our international partners. And I think you really teed off a great point talking about the short-term experiences in global health, because I want to turn to Jody Olson, who in her role as director of the Peace Corps has really focuses on really long-term, deep experiences around the world and focusing on developing that relationship and trust. And so I wanted to move it over to you, Jody, and ask what stood out to you from the students' presentations.
A lot. It was very exciting to see. And I wanted to pick up on Lindsay's phrase of the decolonization of the mind. I'd never heard that before. And to me, it's where it begins to come at where this conversation is. And Jacosa, thank you for your comments, because I felt that your law example illustrated that really well. What I've heard from the sessions, from the students talking so far, I wanted to name 4 words that we all know well, but are we really using them? One is language, and really in the first presentation, such an emphasis on languages that go beyond English and French, or Spanish or Portuguese, into the languages that people speak, because it's in the languages that people speak one learns what is a culture, what is history, what is tradition. Second, a theme that ran across for me was listening, but it's not just listening, it's listening and hearing and internalizing what the other person has said and what am I taking away from this conversation. Third, we all appreciated communicate, 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 and Dr. Sow probably said that 10 times, and I clapped every time he said that, because we cannot communicate enough. And the humbleness that has to come with that communication and with that listening. I wanted to give a particular example, and if there's time, I can give a couple of others. But as Virginia noted earlier, Peace Corps has been online for the last 14, 15 months. And online meant that we had to bring 7,000 Peace Corps volunteers home, doing it from our bedrooms and living rooms and dining rooms, which was quite an experience. But there's an element in this I wanted to mention, that we came together in a way that we had never come together before, that began to equalize the conversations and taking it away from the North and the South, or the East and the West. For the first time, we had our Peace Corps medical officers, all of whom were doctors, all of whom belong to the countries in which they serve, come together with the doctors in the United States. And over the months, as we were trying to address COVID and those issues, we got to know the doctor, the culture he represented or she represented, how they approached COVID in that country in a way that we had never thought of before, because in that nobody was quite right and nobody was quite wrong. We had to be who we were for the citizens of the country, for the volunteers, and for the staff. And what that did was reframe collectively all our thinking, because it would be the Peace Corps medical officer in South Africa that the medical officer in Cambodia would pick up and say, oh my heavens, how phenomenal. And the change in the team in the United States, in our office, changed from what we heard from Mongolia, who approached COVID much more aggressively than any of our other countries. Why? How? What was the background for that? We had to listen, we had to hear it. And what that did was, as we worked in different kinds of small groups, it wasn't the Americans talking to everybody else. It was everybody talking to everybody. And knowing informally who we were for the first time made it easier for us to have the kind of decision-making and processes. So taking from that one particular example to generalize it a bit, as several of you have mentioned about how you have a faculty person from one country working in a class of another. We all dislike Zoom. I got rather tired of it after a year, but we're all good at it. I want to reaffirm the importance of the way that we can communicate now over a period of time to get past the countries, get past the languages, into the actual cultures, so that we're hearing them equally. And we can learn from each other equally in a way that we tend to think of us's and them's. This last year at Peace Corps, there were no us's and them's. There couldn't be any, because it was the only way we could survive, was to hear everyone equally in solving the problem. I'll stop there for now.
Thank you so much, Jody. And it really, you are reflecting back what Dean Banda said about the course and the value of really learning from each other. And I know, to go to you, Alicia, you talked about recently getting another degree from the University of Buenos Aires, and how that experience studying in a different language in a different type of university was very important for you. And I think we're all gathering here as students and educators around what a university can do to decolonize global education, global health education. Can you share some thoughts from that experience about the role of learning in decolonizing the mind?
Sure, I can share some thoughts on that experience. I share Jody's view of the importance of decolonizing the mind. I think originally that was Frantz Fanon's phrase, which is the most important thing that. And I guess actually before I answer that question, I want to say a couple of other things from the first round. One is that I'm very fortunate that I work at a global health and social justice organization called Partners in Health. We have a philosophy grounded in decolonization. We have an approach called One PIH, where all of the different sites are part of the Leadership Council. We have COVID-19 daily briefings where we share information and strategies, both on the latest scientific information as well as the ground up information all the time. And that changes the entire ethos of the organization. So I'm happy to talk about that more in another question. In response to this particular question, I'm happy to talk about Buenos Aires, which is a model of public education, fantastic public education in the country of Argentina, with all of the challenges of funding, et cetera. But it brings up, more than my personal experience now, it brings up a question which I think is worth considering as you go forward with this, which is there is not a global North and a global South, right? There are many, many different kinds of communities and countries. And within Latin America, Argentina is entirely different from Colombia, Mexico, the Central American countries. In sub-Saharan Africa, what is going on? I mean, I lived in East Africa, so I can say, like, if you actually know the countries, Kenya is very, very, very different from Tanzania. And you would say, oh, it's just East Africa. It's not just East Africa. So, I think that it would be, it's very important to kind of break down that dichotomy, because by using the dichotomy, it actually reinforces colonialism. Yeah, in terms of learning from Argentina, I think one of the things that I learned, and I have family in Argentina, I've grown up between South America and North America, is, how much still our education in the global North takes for granted and privileges a certain category of expertise, and how much, as has been said, language creates a kind of hierarchy in terms of what defines the field and what is cited and treated as you know, the knowledge, as Chikosa said, that the ideal, the things to be cited, and that has a self-reinforcing cycle of people who want to publish, refer to this paper, refer to that, and it just reinforces itself. And I think we need to break that down.
Thank you. I'm looking at the time and I don't know where it's gone, and we need to have these conversations. Let's consider this just a start of a really important and long self-investigation and reflection. And so can I ask first Chikosa and then and Shani, Chikosa, do you have any final thoughts about a path forward in this area from your experience as the Dean of the Law School in Malawi? Chikosa, did you hear the question? We may have some.
Oh, he's on mute.
Yeah, Chikosa, I think you're on mute.
Oh, sorry, let me just unmute. In terms of the way forward, as an institution, we are now in transition, and because we have become a new university, we have linked other colleges. But apart from that, we are undergoing a process of curriculum review. I think it's an opportunity for us to rethink what we teach and how we teach what we teach, and what material do we expose our students to. So I guess that's where international collaboration would be very helpful as well for both institutions. If we look at what we do, we have been training lawyers mostly to serve the elites or to serve the rich, because those are the ones that can afford. So now the issue is we are in a paradigm shift where we're saying, why don't we educate lawyers for social justice? And how do we ensure that our students understand the context in which we're operating a little more? One major challenge we have as a university is our catchment area, because most of the students that tend to be selected to law school tend to be those from either elite or maybe, let me say, middle-class families who essentially already have a colonized or a colonial mindset. And now that's where the challenge comes in. How do we ensure that the students that we train are fit to work within the context in which they are working? For example, I think Teuka talked about language and the idea that we should serve the communities, or the community that we are serving better. So my view is that we need to pay attention to the content and substance of what we teach, and then to the pedagogy or the methods that we use. And I think the Malawi-Maryland collaboration provides that useful link. How I wish we went back slightly to what we used to do before, where I would get the students to live within communities or to live close to the communities. And then we would not just get law students to get into there. We would get social work students, pharmacy students, and others. So the idea of introducing international collaboration and interdisciplinarity. So the idea is to demystify some of the dominant understanding that we have, and then to ensure that students understand the legal systems or healthcare systems from the perspective of the community that they will potentially serve. So that's basically what we think. I think we need to start with curriculum review and to review the way we teach and how we deliver our courses, and then to also look at potential advocacy for the reform of some of the laws that we have. For example, we have a Public Health Act that was passed in 1948. It was there to save the colonial master. We are still keeping it. And the COVID-19 crisis revealed that it's not fit for purpose. So the idea is, how do we address these issues. We look at the substance of the law, the substance of what we teach, and how we teach. So I thought that future collaboration should focus on that, plus generating information that we use. So research is a key issue that we need to work on a little more, because we cannot talk about colonization if the information that we use or the information that we expose our students to is the same information that has been informed by colonialism as well. So we need to come up with a system that addresses the issue holistically, as opposed to just looking at it from one particular perspective. So in short, our teaching, our research, our community engagement itself need to be decolonized as well. Even for our students, they should not be going to communities as saviors. They should go to the communities as collaborators. They collaborate with the communities to find lasting solutions to problems that communities face. Thank you very much.
Thank you so much, Chikosa, for raising the important issues of interdisciplinarity, of contextualizing laws for the community. And I'm really struggling with the time. I hope for the rest of our panelists, we all stay engaged in some other ways, because I want to turn it over to the Chancellor of the University of Maryland System, Dr. J. Perman, who used to be the president of University of Maryland, Baltimore, and set in motion many of the initiatives that you've heard about during the summit. And I hope you enjoyed, Dr. Perman. It's nice to see you. I hope you enjoyed some of the things that you heard briefly. We're so happy to close this summit that seemed to race by. There's so much to talk about, but I think we've really heard from the students, and this is a good starting point. So thank you for joining us, and I'll turn it over to you.
Thank you, Virginia. I have been listening. I've learned a lot, even in the short time that I've been listening to the panelists reacting. And I apologize for my role in shortening the session. But thank you for having me. Thank you to everyone participating in this terribly important summit. I'm so happy to see the work that a number of us began together flourishing like this. It's hard for me to believe that it was 2 years ago that we last gathered around this time of the year at such a summit. Somebody mentioned Dr. Sow. I was in the audience the last time when Dr. Sow brought down the house with his keynote, recalling the Ebola crisis in Mali and how he and his colleagues at CVD Mali waged an effective war against the disease. I remember thinking at that time how lucky we were to work with him, how lucky we were to learn from him, and really from all the colleagues who at that time came from around the world to share their expertise with us. One of the panelists mentioned the importance of bi-directional learning. Just a few months after that summit, I had the privilege to travel with some of you to Zambia and Botswana to see some of our partners' work firsthand. At that time, I also had the privilege of meeting with colleagues from Kenya, Rwanda, Tanzania, Nigeria. And then, of course, we succumbed to disease on a global scale. And again, I think how much better we are for this global health infrastructure we're building, how fortunate we are to rely on the deep knowledge of our international partners, how blessed we are for their collaboration. But you know, nothing clarifies the failings of global health quite like a catastrophe. And this pandemic invites us to examine where neo-colonialism continues to infect our conceptions, not just of global health interventions, but of global health itself. And potentially who becomes our next generation of global health scholars and practitioners, how these professionals are trained, how their work is disseminated, how their ideas gain influence. This work is, of course, and I'm mindful of this, intersecting with the United States' own reckoning on race, our examination of the systems and structures designed to disadvantage populations, and our dissection of academia itself, which has historically admitted and amplified certain voices over others. The colonizing of global health is, in my view, not so far from the gatekeeping of the academy. What you're doing is rewriting narratives long accepted as truth, rewiring practices long accepted as best. What you're doing is dismantling centuries of racial and cultural hegemony that frankly have perpetuated unequal access, unequal influence, and unequal power. It's a challenge. I admit it's a challenge for me. And so I'm very proud of the students who are leading this work, the students who really walk the walk of global health education, equity, and inclusion, and who hold our feet to the fire to do the same. I thank President Gerald, Dr. Fyron Guzman, the Center for Global Engagement, and all of you who have contributed to this terribly important conversation. Thank you for letting me say a few words.
Well, thank you very much, Dr. Perman, really from the bottom of our hearts for your leadership and allowing us to have these conversations. It means a lot, and we're so grateful, and it's so fitting that you can be here to share your words to close out the summit. So on behalf of the summit planning team and everyone that was involved, thank you all for attending. And we will be back in touch with recordings and more information. But again, thank you to everyone and have a good rest of your day.